Good morning, everyone, and a very warm welcome to this 60-minute briefing on public trust and evidence-based policymaking, lessons learned from the COVID-19 response, organized by the European Policy Center in the context of the PROGRESS project. Thank you very much for joining us today. While I still see there is more and more people joining, I'll take the opportunity to introduce myself first. My name is Johannes Greubel. I'm a policy analyst at the European Policy Center, and I'll have the pleasure of moderating this discussion today. And what we will do today is we will discuss the link between public trust and evidence-based policymaking in the context of the COVID-19 pandemic. We'll try to take stock of the response so far, discuss the role of scientific advice in shaping the COVID-19 response, and also how evidence-based policymaking can not only lead to a better crisis response, but also foster public trust in this response. Before we start, however, I would like to introduce you to the PROGRESS project, as this event is part of this project. And I'll take the opportunity to share my screen for that, as there's a quick presentation that I wanted to share. The PROGRESS project, and PROGRESS stands for Promoting Integrity in the Use of Research Results, is a Horizon 2020 project that seeks to support evidence-based or evidence-informed policymaking. We're a consortium of 14 research entities from many different European countries, from universities to foundations to think tanks, and we're covering a lot of different project areas. And a goal in general is to promote evidence-based policymaking by encouraging policymakers and their advisors to seek evidence for their decisions from research that has been conducted ethically and with integrity, under the motto, good research will lead to better policies. And of course, on the other hand, our goal is also to support and encourage research entities and researchers in achieving this trustworthy research. So what we're advocating is that ethically sound evidence should have its role in policymaking. Because what is clear is that when evidence informs policymaking, any mistakes, any fraud, or any corrupt practices by the evidence providers can lead to a serious damage of the social, the economic, and the cultural structure of our society. At the same time, however, we realize that there's no comprehensive ethical code for policy advisors and research organizations that seek to inform policy makers. And this is exactly the gap that PROGRESS seeks to fill. So what we did is constructing a guidance framework based on 3 pillars, and very much central there, even if on this little structure it's the left column. Pretty much central is the STEP Accord, and this stands for Scientific, Trustworthy, and Ethical Evidence for Policy Accord. And that accord lays out principles for ethical research that we hope that many or even all stakeholders involved in the process can sign up to. And this accord is complemented by a toolbox for policymakers and their advisors to help them identify ethical evidence for their decision-making process. And it has supportive resources that complement the accord and the toolbox. And that's exactly where we are at the moment. Without wanting to go too much into detail, we're currently finishing up the design of this framework after several iterations and several stakeholder engagement processes that we have had. And I hope that in the next stages, many stakeholders can endorse and sign up to the accord before we present it then in September in a final conference. And I want to leave it there at the moment, knowing that Dónal, who will speak later, will or might come back to the project and its results. If you want to know more about the project, about the STEP Accord, I encourage you to visit the ProRes homepage, which I will share with you in a minute. Let's get back to the topic of the event, public trust and evidence-based policymaking. During the last 15 months, let's say, the pandemic has confronted the European Union, but also national, regional decision makers to react in a fast way, in an effective way, to a challenge that has been unprecedented so far. And the unprecedented nature of this also brought a lot of other challenges with respect to the evidence base that we can base our response on. Evidence very often was incomplete or was developing over time, so that also the advice has changed over time. And at the same time, we witnessed a flood of misinformation, disinformation, which has aggravated the situation even more. And I think both aspects, the challenges regarding scientific advice, with also resulting changes in the responses to the pandemic, but also mis and disinformation have or might have led to the fact that the public trust in the COVID-19 response might have suffered, at least in certain parts of the population. But on the other hand, of course, especially in these crisis situations and in situations where the crisis response includes heavy demands on each and every individual's personal behavior, trust in policymakers and in the evidence is essential. So that's exactly where we want to start off the discussion, and want to take stock and draw lessons on what has happened so far, on the role of scientific advice, on evidence-based policymaking, but also how to foster public trust and the role of communication in that respect. And to do so, I have two fabulous speakers here with me today who will help me unpack these questions. I have here Lene Næsager, who is Director for Corporate Communication and Strategy at the European Commission's Directorate General for Communication. And as such, she oversees the Commission's strategic communication and also the communication campaigns, also with respect to the coronavirus pandemic. And she will shed light on the communications aspects of our discussion today. And then secondly, I have the pleasure to welcome Dónal, who is Associate Professor at The Ohio State University and also Director of the Center for Disaster and Humanitarian Ethics. And his research focuses very much on the connection between ethics, decision-making, and evidence. And he has worked extensively on disasters and the impact of disasters, especially in the context of the healthcare response. And of course, he's a member of the ProRes consortium. And we've worked extensively throughout the last years in this context, in this project. So I'm very much looking forward to hearing from both of you. We will shortly have very short 4 to 5 minutes input from both of you. But afterwards, I would encourage every one of you, every attendee, to take an active part in that discussion by posing your questions and comments. And you can do so in 2 ways. You can either put your question into the Q&A box in the bottom of your Zoom page. I would just encourage you if you do so, please keep it short and sweet. Please no essays, but tweet length would be fabulous, so that I can have an overview of all the questions that are being asked. If you want to come in with a comment or a question directly, you can also do so by raising your virtual hand button also on the bottom of your Zoom page. So you'll be able to interact with us in these two possible ways, and I encourage you to do so whenever you feel the need to ask a question or have a comment. Without further ado, I want to turn to the two speakers, and I want to start off with Lene. Maybe you could give us an overall assessment of the situation. I mean, we've gone a long way from or since the outbreak of the pandemic in the last 15 months with respect to how European institutions reacted to it with policies, but also in communicating this response. So maybe as a starting point for our discussions, could you tell us where we are at the moment when it comes to this response, when it comes to public trusts? Do citizens trust the European Union, European policymakers? And what were your strategies to achieve exactly that in the last months?
Yes, thanks a lot, Johannes, and I'm very happy to be here at the EPC with Dónal to discuss about this topic. And I'm very pleased that you have organized this event, because I think it is important to have a discussion about public trust and also evidence-based policy making. You're absolutely right, Johannes. We are in a situation where we are living through an unprecedented crisis. We have never seen something like that before. And it has changed so much, our way of living, our way of interacting with other people, the way we work. As you see, I'm still doing telework from home. Everything has changed in our lives. And there has been a lot of suffering in people's life for the reasons of Corona primarily, but also because of the fact that our daily lives have changed so much. So we would never have thought for 18, 19 months ago that we would have been in this situation today. And that also requires, due to the fact that we have been living through several lockdowns, where businesses had to reduce their activities as well. Factories were shut down, the overall economy slowing down. It also meant that the challenge of the European Commission as policymaker, proposing all the initiatives that we now have today on the table, was extremely high. When our president took over the reins of the European Commission in December 2019, we would never have thought that we would have such a huge challenge in front of us in order to put measures in place, to seek to give the right tools to our economy to recover. And we have really tried in several areas to provide for the right responses in terms of policy making. So we talk about the Green Deal, the green and the digital transition. We talk about recovery measures. We talk about a lot of other tools that are present and that are being decided by the Council and the European Parliament and to be implemented by member states. So the big recovery and resilience package, as you know, is now being scrutinized by the Commission. We have already done quite a lot of the homework, being presented by the President when she has been around in Europe to, I think it is around 14 member states so far, and there are more to come. And this is the National Recovery and Resilience Plan, really in order to give, again, trust in Europe, trust in the economy, trust in the way that we are living. This is a very important part of our work today in the European Commission. And as I said, everything is linked up to trust again. We need to have trust in order to recover from the crisis. Another strand is, of course, the vaccination. And there we have had a huge challenge in relation to the development of vaccines, to have these vaccines approved by the European Medical Agency. These vaccines, they were actually developed in a record time. And normally it will take about 10 years to develop a vaccine. Here we were talking about some months only. And they were rolled out in the beginning of this year. And really an important issue, because we used EMA, our European Medical Agency, as the proof for the safety of these vaccines. So there we come to the evidence-based policy making, because we approved the vaccines due to the fact that they were tested and checked by scientific from all member states working in EMA. But the challenge is here that, and you have all followed the discussions around the vaccine rollout here in Europe, and also what happened with AstraZeneca. The challenge is really to get citizens on board to take the vaccines. We have managed in some member states pretty well. You know, we have a target of the 70% herd immunity. Maybe with the new variant Delta, it needs to be much higher. But we still have in some member states where the vaccine rollout is a bit timid for various reasons. And here we come back to the question about trust, about mis or disinformation that is happening in some parts of our society. And it's also linked up of the question on trust in authorities, which is sometimes not that high in some member states. In fact, in Europe, you see an extremely diverse picture in relation to trust in authorities and trust in member states, trust in the EU, trust in vaccines. In the country that I know best, there's a high trust in the national authorities. There's a very good trust in the EU. And there's also high trust in vaccines. So everything is linked here. If we lack trust, it leads to a lot of confusion in the society amongst the citizens, but also it leads to a situation whereby citizens, they are not going to follow the calls from the national authorities and to go and get vaccinated. This is a real issue that we have in some member states. So what we did during the pandemic inside the Commission, it was that we quickly understood that there was a need really to create synergies and harmonize our communication towards the external world. So what we did, it was that we set up a task force, coronavirus task force, we called it, just after we had made a totally new website on the coronavirus response, in order to show to decision makers, to citizens, to businesses that we are really there with a lot of information that they could easily take from our website. A lot of activities happened as well on our social media, and we had a lot of our commissioners going out strongly and explaining what it was that the Commission is doing in this very complicated time. And in this task force on the coronavirus response, we were also tackling mis and disinformation in order to ensure harmonized mapping, so that we knew what was going on, and when it was needed to go out with rebuttals. And you will find on our coronavirus website that there is kind of chapter which is on the mis and disinformation in relation to the coronavirus crisis. That was one thing we did. We also had in some member states, not in all, some national task forces really to detect what was coming up in terms of mis and disinformation. They reported back to us here in the headquarters in Brussels, and then we organize the work so they will be able to get the right rebuttals in time, so they could communicate at a very local level. Because the picture is very different from one member state to another in relation to mis and disinformation on the coronavirus pandemic. What we did later on in the year 2020, it was that when we started to have the discussion about the vaccines, it was that we also set up an internal structure to coordinate the work with the other EU institutions about the infodemic in relation to vaccines. And this has been a very intense work that is still ongoing, because we have a lot of mis and disinformation out there that is still continuing to spread. So colleagues, they meet, they have met on a weekly basis now. It's every second week, exactly to do the mapping on the basis of information coming from our joint research center, from the external action service of the Commission, from our media monitoring as well. And on the basis of that, we are providing and making available inside the institutions a newsletter on a weekly basis, Fighting the Fallacies, where we have detected the most prominent misinformation stories. And then we are proposing a line to take, whether to act, not to act, and if we act, what should be said. So this is something that we have done in the context of this crisis. And we still have a lot of challenges in front of us, because we are just in the middle of our crisis, of the coronavirus crisis, and we don't know what the future will bring. We now talk about a boost of the vaccine in order to be able to cope with the new variants that we will have. We see today that the Delta variant is really stepping up its spread, if you could say it like that. In some EU member states, we already have 60% of the infected citizens where it is the Delta variant that is taking over. So we don't know what is going to happen in 2 to 3 months' time. Are we going into a new lockdown? What is going to be our daily life? And that's also the reason why it is so important to communicate about what it is that we are doing from the EU side. I will soon stop. And what is very important is that in relation to what I have said now, our Next Generation EU, it is that this recovery campaign in member states is really going to be spread out. We are having a corporate communication campaign that is running now in the member states that the president has visited, in order to create awareness, in particular amongst the young target audience that we have identified, the Gen Z, in order to explain to them what is it that we are doing for you here in this pandemic. And there will be much more to come. But I will stop here, because I know that I have been talking a bit too long, a bit more than my 4 to 5 minutes. So thanks a lot.
Thank you very much, Lene, for this initial input. You already touched upon a lot of topics that I would like to go deeper into detail later on. Vaccinations, trust in Europe, the infodemic that you mentioned. I want to discuss this later. I first want to get to Dónal and asking him about his opinion on something that Lene also mentioned before, with respect to this uncertainty and the challenges of uncertainty with respect to Corona and future developments. I mean, there's a number of people within the Commission, but also within other actors, within other governments, that are supposed to advise policymakers how to deal with these uncertainties, how to implement decisions based on evidence, or having these decisions informed by evidence. what is the role of a researcher and the policy advisor in this situation, and especially what are the challenges in these challenging situations where there is no comprehensive evidence-based, where evidence is changing over time and might be incomplete?
Thank you, Johannes, and thank you for inviting me to come along and talk this morning. And Lene, it's been very nice to meet you and to be involved in this with you. I would say that with uncertainty, I think there is a very important role that researchers play. And I think it maybe could be combined into two general areas. And Lene has touched on, I think, the output that can happen from both of these areas. But one is the actual research itself. And I think the UN Office for Disaster Risk Reduction has a very clear strategic program, and they highlight the importance of research in developing what they call robust evidence that is going to guide and inform policy making. And so research has a crucial role there. The World Health Organization came out with a roadmap for research in March of 2020. And they kind of added in an element, or at least highlighted an element talking about the moral responsibility that researchers have to respond accurately and quickly to provide the evidence that's going to help people dealing with the uncertainty and the whole situation. And I think the example of the vaccines just highlights how amazing a research response can be. Like Lene was saying, the fact that instead of years of waiting for a new vaccine, we had one within months. And that is really amazing. I think it is also a reflection of the sort of the ongoing importance of research, because even though the COVID-19 vaccines themselves were very new, the early ones, the messenger RNA ones, were built upon a couple of decades of research into that type of vaccine that had already been going on, had not sort of achieved the success that researchers were hoping for. But it's part of that ongoing effort within research to continue to try to find new approaches to address general problems. And then when a crisis comes along, like the pandemic, then hopefully as quickly as possible, the research enterprise can direct its attention to that, like what has happened. But I think there's then a second broad area where research is very important, and researchers have another responsibility, and again ties in very directly with Lene's area of communication. And what I think is very important in that area is that researchers who understand the details of what a messenger RNA vaccine is and how it works and what researchers need, that they're able to communicate accurately and transparently where we are in the research, where we are in the problems that need to have research done on them. And so to be able to present a very accurate picture. And unfortunately, one of the things that has happened during the pandemic is that we have had misinformation. And some of this has happened in areas that is just completely unethical. And so there have been examples of articles which were in the major medical peer-reviewed journals that ended up being retracted because it appeared that it was based on at least data that was not accurately put together, or questions have been raised about whether certain data even existed, and yet people decided to take advantage of the opportunity and get some sort of a publication out there that unfortunately was completely misinformation. And so we've got things from that end all the way to where I think we've got researchers involved and helping people to understand that in the early days of the pandemic, that you simply don't have easy answers to many of the problems. And so avoiding the kind of hype that sometimes can go along with certain interventions. And we are in a very challenging situation at the moment, I think, with the whole development around social media, where now anybody can post anything that can get out to massive audiences. And it is a new challenge to come up with ways that people can be provided the help and the guidance and direction to finding reliable information. And I think this is part of the challenge that we're in the midst of, and it ties directly then into trust. If somebody can read, everything from, people supporting certain interventions on social media to people saying, no, there's no evidence to support those, and everything in between, then how are they going to filter that? How are they going to go through and come to their own conclusions around that? And I think this is where researchers have an important role in communication, to be able to explain when, for example, one of the medications that was talked about a lot about last year was ivermectin. And it received a lot of publicity because there were some laboratory-based researchers who published information on the effectiveness of ivermectin in lab studies, but they made it very clear that this was done in a petri dish, so to speak, in the lab. It was not giving this medication to patients or even to animals. They were simply using them in cells that were in a dish. And yet the results of this got promoted in ways that suggested that actually this was a highly effective medication. And it went all the way to the point of becoming recommended in policy documents, particularly in a number of South American countries where this particular drug was being used to treat parasites. But I think where researchers need to step in then is making it very clear how a study that is being done in the lab is very different from a study that is being done in patients, and that the uncertainty is going to continue while the research process continues, and that we have to have patience and wait for sort of the research cycle to move forward, going from lab tests to other types of tests before we can actually roll something out. And that is what happened with the vaccines. We saw that even though that research was happening quickly, there was communication about it. The regulatory agencies were saying, we need to review this evidence quickly, but we're also not going to just let these vaccines out with little or no evidence to support them. And at the same time, there needed to be accurate communication about the fact that if this vaccine exists for only 6 months, you can't have long-term or evidence about the long-term effectiveness or the long-term side effects that could exist. And again, it's about the accuracy and the openness and helping to communicate that in clear ways. So that's my initial take on where I think researchers have an important role.
Thank you, Dónal. Very interesting points, and I want to come back to the role of researchers in communicating science to the public at a later stage. Let me first come to a topic that both of you mentioned in your initial statements, which is the topic of misinformation, and what is the right approach to counter this misinformation. We had Vice President Jourova speaking at the EPC a couple of weeks ago, and she outlined that with all the flood of disinformation that reached the EU regarding COVID, she realized that the more they try to counter this disinformation and the more space they leave free, which then again is being taken up by even more disinformation. So for her, it was much more important, or the focus should not primarily be on just countering disinformation, but having a more proactive communication approach and having a narrative to formulate. Is that the right approach? Do you agree with her? And if so, how can we get ahead of the curve, so to say, from a communications perspective, but also researcher perspective? Because I know, Dónal, you also spend a lot of time analyzing disinformation and misinformation in the vaccine context. Maybe let's start with Lene.
Yeah, okay, thanks a lot. Well, misinformation or disinformation, there's a difference between the two, of course. The disinformation is really intentionally to say something that is clearly wrong in a specific context. Misinformation, it's lighter. And what the Vice Presidency mentioned, it is that, and I agree with that, if you go too strongly out in order to rebut these stories, you may end up in a situation where you actually are spreading them. So you're generating even more attention in relation to these wrong stories. And that may not be the best approach. So from the Commission side, we are very, very attentive before we go out in relation to our rebuttal. What we want to do, it is to place facts, clear facts, good stories on our social media, not only on the central corporate accounts, but also in the different member states where we have, in all member states, we have representations. So we really reinforce the positive stories. This is very, very important because we shouldn't be some kind of engine behind the spread of disinformation, because that will simply backfire. A very important work in the Commission is the mapping of what is out there. And we are using quite a lot of effort, not only to have the mapping at a European level, what is going on in Europe, in the EU, but also we team up very closely with the External Action Service to see what is out in third countries, because sooner or later, if it's not already in Europe, it will come from third countries and then be a story in Europe. But the best thing is really to get the facts right and to provide positive stories about what we see is going on out there in terms of mis or disinformation. An example is, for instance, you probably saw the Euro 2021, the first match, football match with Denmark, where you had the young Danish footballer Christian Eriksen, who had the heart attack in the beginning of the match after 10 minutes. And then what happened after that, it was that it was said in some social media that this was because of the fact that he had got the vaccination. Of course, this is not true, but it is important to then indicate what are the clear facts, and that is also being done in the media.
Dónal.
Yes, I think this is a real challenge that we have to look at, particularly as researchers who are used to being kind of stuck in or digging down into the data, and that's kind of where a lot of us as researchers are comfortable. but that a lot of people, I think, are not as interested in the numbers and the raw data. And we have to be sure that we're communicating and meeting people with the concerns that they have. And so I think in part of what you see in the ways that, say, vaccines are being rolled out is that some people are not as interested in the numbers about how effective or what percent of people have this and that dimension to it, but they're interested in finding someone whom they trust who is going to share with them why they believe in the vaccine. And this could be a healthcare professional that they have a trusting relationship with. It may be somebody in a university where there's trust, or in a public official. But I think this is where society has changed quite a bit in the last few decades, to where there was trust in certain types of authority figures or certain roles, like the university professor, so to speak, who people would trust completely. But instead now people want that connection with somebody. They, as Lene was saying, they want to hear a story and how that connects with them and their concerns and what's important to them, not the numbers. And I think this is part of the challenge for us as researchers, to not simply communicate on the level that we're fully comfortable, but actually to understand the audience, I guess, well enough. And whether that's an audience of one, and so somebody that we meet in our neighborhood, in the classroom, and to be able to communicate at that point with them, or others, say, the healthcare professionals who will take the opportunity to talk with somebody in a way that keeps the communication going, as opposed to shutting it down because of an engagement that isn't very positive and communicative.
If I may come in, I can only support what Dónal is saying. It's really about having healthcare professionals, when we talk about vaccines, to indicate that, well, you can get the vaccination, it's not a problem. And to have these kind of role models in which we have a lot of trust. And it actually, during the crisis, it turned out that doctors, nurses are really people in whom citizens they trust. And we have used that as well in the commission in relation to our social media activities, where we had a lot of pictures of nurses, doctors getting the shot, the vaccination. And also we have virologist Peter Piot, who is an advisor of the president, who has, I don't know how many Q&As he has been doing on social media about the vaccines. All kinds of different questions where he has, during 15 seconds, responded. So this is really because he is a trustworthy person, because he knows a lot about virus, and he is really being considered as somebody who is giving the right information. So we are using him a lot on the social media, together with the nurses and doctors who have got the jab as well.
Thanks. And I think is exactly what you indicated, this role for doctors, for researchers to play in fostering trust among the public is also something that came out in the latest Eurobarometer data. There is one very interesting one from last May that basically confirms the observations that you just made with respect to people trusting doctors and researchers. Let me follow up with a quick question from Tobias Schmidt to Lene, mainly, who asks what you are doing in the Commission about member states or government which openly use the EU as scapegoats for failures and create distrust in the EU. leaving aside the fact that they are themselves member of the council. And that might create very good reasons why the EU cannot deliver. What do you do against that?
Well, it is something that has gone on for years. When we have a proposal that is being adopted in the council, if it is positive for a certain member state, the minister in question, he goes back and he says, "Victory for us, I did." It's not that we did in the EU come to a good compromise. It is I did. If there's something that is not going along the lines that the minister, he may wanted it to be, it is the failure of the Commission. So we are in this situation where, and we try to do something against it, of course, where failures are being blamed on the Commission and victories are only the victory of the member state in question. So very often we are not in a system, we with ministers, they don't tell citizens that they are in a system where it is negotiations, common compromises, and where not only victories should be indicated for a specific country, but it is for the EU as a whole. It is something that we flagged clearly in 2019 in May when we had the CPO communication adopted by the heads of state, where we really stressed that what is going on in the EU is common responsibility and we need to communicate accordingly, and the communication is a joint responsibility of member states and of the EU institutions, and we have to be on the same line. So this was a clear intention and a clear statement of the heads of state in May 2019. I know that the world is still different, we are not yet there, but what we really seek to do, it is that in relation to the council, where we have the member states represented, we have a working party on information meeting almost once every month. And this working party on information is composed by representatives of the member states in charge of communication. And I'm the lucky one to go to these meetings quite often in order to explain what it is that we are doing from a communication point of view, and to stress to the member states that we need to be on the same line when we communicate locally in member states. What we also do with the member states, it is that whenever we can share communication assets, we do it. We have a platform to which the member states, to which the European Parliament, Committee of the Regions and the Social and Economic Committee have access in order to be able to communicate together with us on, for instance, Next Generation EU, on, for instance, the vaccination. So we try to do a lot in order to give member states access to communication assets so they have the tools to be able to communicate. Still need to see to what extent it's really being taken up, because it is a new initiative that was put in place last autumn. In relation to deliberate counterproductive communication done by a certain member state, we need to have a lot of evidence regarding to that before we can take concrete measures. But I can reassure you that from my past experience, I know that a lot of commissioners being responsible for a particular policy area, when this is happening, it's also being said very clearly in bilateral meetings with the minister in question. So I will stop here.
Thanks, Lene. There are more and more questions coming in. I want to collect 2 or 3 of them. We have, first of all, one from Lene Spiraku, who said that in addition to evidence or concentrating on evidence-based policymaking in the COVID-19 pandemic, we have the challenge that evidence-based policymaking needs to contribute to the rebuilding of public trust to science. Do you agree with that, and what do you think? And we have an answer as well to both of you. And we have a question as well from Paul Butcher, who asks that data voids, which means that we simply don't know something. Data voids can easily be exploited by disinformation actors. How can researchers and policymakers communicate to make clear what is and what is not known, to prevent others to trying to fill these gaps with wrong or misleading information?
Well, maybe I'll react first, because I think those are both very good points and very important areas. With the data voids, I would say that, again, it's about clear and open and transparent communication. And so, for example, I'm involved in some research at the moment where we are conducting interviews and focus groups with nurses to understand what was it like for them on the front lines during the really difficult days of the pandemic. And one of the real challenges for them was the uncertainty and the changing policies, so that one day this is how you approach a patient, or this is what you're expected to do before you go into their room. And then the next day, all of a sudden, the policy was different. And there's a level of which that's understandable during the uncertain days, but it was not being communicated clearly to them why policy was changing. What was this based on? And I think this is where simply coming in and saying you do it this way and then tomorrow you do it that way is not enough, that there needs to be a way that people start to be provided the basis for those policies, and that can help to avoid some of the challenges with people feeling like, well, nobody seems to know what's going on here. That can be very distressing when you're actually in the midst of it all. And I think this is part of where research can now help in the rebuilding, so that we learn from our experiences and we see where in the future things need to be done differently, or maybe today things need to be done differently, because, you know, as Lene has been saying, we're not out of this completely yet. And so we need to be continuing to change, but making it clear why and on what basis. And that would be my reaction to those two questions.
Yeah, should I come in? Sure. Yeah, thanks a lot. No, but about data voids, it is a real challenge, and it is clear, and this is also very human, that if there are no concrete information or communication about a specific issue, a lot of people, they start to guess. This is normal. This is normal human behavior. And that is also the challenge that we have as communicators. It is really to be able to kick in as soon as possible when there is an issue out there that needs to be addressed. And it is complicated, because when we talk about communication as the EU, we are being faced with 27 realities, and even more if we go down to a regional level. And therefore, it is very important that, that we in the Commission team up with our representations in the member states, because they know the national reality as such, also the regional realities, in order to fill the communication space with the right information in relation to some specific issues, whatever they may be. And it is also very important to have this, to have the science supporting the decision making that we are doing in the EU, because that is how citizens will be in the EU and in also the national institutions. But there is a good thing, it is that during the last 10 years, today, the trust in the EU is higher than it has been before. So despite of the pandemic, the infodemic, despite of all the challenges that we have from an economic point of view, the trust is better than it was for 10 years ago, and it has never been higher.
Thanks. I want to end with two questions. first of all, to Dónal, as kind of a rounding up question to the ProRes project. What can ProRes bring into that situation? Where can ProRes bring an added value? And maybe an additional question raised by Teodora Frampicesi, that we are, I mean, Dónal mentioned this before, the public, the general public is not familiar in dealing with large quantities of data, large quantities of evidence anymore. What is the role of the researcher there? How can we communicate as researchers, but also communications experts? How can we communicate these complex issues, especially as there's the challenge that communications usually tries to seek, you know, short slogans or short answers to questions that are now very complicated, especially with respect to vaccinations. I saw there were a few questions on vaccinations. So what role is there to play? How to deal with this?
Well, I think that's a large area, and I think very quickly I would summarize it into the area of what's typically today called knowledge translation. But it is you know, a form of communication where, again, as researchers, we are used to being in the nitty-gritty details of a research project, but that then we also need to take time to disseminate those results, both in the academic literature, in policy briefings that will impact policymakers, but then also at a more general public sort of level. And, you know, I think this is where we've to find those who are interested in helping us to make that translation into a level of communication that will reach the person who doesn't want the technical details, but they do want an accurate summary of things. And so, for example, one of the things I wrote last year was I was asked by the leadership in our church to put together something based on my knowledge of the research, and they helped me then to communicate it at a level for an audience that was not technical. And this is, I think, a role that is maybe new for many of us as researchers or academics. We would much rather be writing an academic paper, but we need to engage with people where they are and in ways that they can understand that information, and help them to come away with the degree of understanding that they're really looking for.
Yeah. Should we also, and that is something that Sławomir Gorboc asked, should we have a more open discussion related to vaccination? Because he said by preventing every discussion related to vaccination, what is now visible in some member states might have the opposite effect, might not lead to trust in the vaccines, but distrust in the vaccines. Should we have a more open discussion about the risk and chances for the vaccine?
I would say yes. I think this is where we need to have open discussion rather than shutting it down and saying, well, if you've got a criticism, you can't bring that in here. I think that will have the opposite effect. And that's where I think people who are involved in practice, like the medical professionals and the researchers who are able to, you know, to say, well, yes, this is what we know about side effects. This is you know, what we understand about how these work, and able and comfortable to take the tough questions that a lot of people have. I know I had them myself at the beginning. I was like, how could I take a vaccine that's only existed for a few months? But it was once I was able to dialogue with the data and with others that I trusted that I was able to see, oh, actually, this is something that I'm comfortable to take. And I think that's the sort of open and transparent type of discussion that needs to happen, not one that's filtered by not allowing certain questions.
Lene.
Yes, thanks a lot. I totally agree that it is important to have open discussions about vaccines, but also on other issues that generate a lot of debate. If authorities try to close down such a discussion, it will only backfire, because citizens, they will start to ask themselves questions. Why can't we debate? Why can't we discuss? Why can't we get the answers to our questions? So this is a real issue. So of course, from our perspective in DG in the Commission, we can only invite to discussions about these issues, because it is important. And only by having the right information, citizens, they'll be able to get trust in the vaccines. But what also is very important in the discussion about vaccines, it is that health as such in the EU is national competence. So it's very much for each member state to make the vaccination campaigns go and get vaccinated, to make this call to citizens, because the European Commission has organized that vaccines are available. It is a success story that we have been able, as Dónal also said, in so few months and time to be able to deliver so many vaccines. It is a real success story. Had we not done it as we did it in the EU with the common procurement procedures, there will have been many member states who have not been able to get hold of vaccines at all, due to the diversity in sites and other issues. So of course, debate around these issues are crucial in order to be able to generate this herd immunity that we so badly need, in particular with the Delta variant coming up now.
Thank you, Lene. I think that's very good last words. Unfortunately, our time is already up. There are a lot of more questions that I see in the Q&A box that we couldn't answer, unfortunately, but maybe we can collect the questions that we couldn't answer and see if we can reply to them in another form at a later stage, either in written form or follow up with them in other events. I would like to, when coming to an end, I would like to thank both our speakers, Lene and Dónal, for your input, for the very interactive discussion. Your input was very much valued at all stages, and especially a thanks goes to Dónal, who is in the US at the moment, and it's 6:30 for him in the morning. So thank you so much for making time at such an early time. And also a big thank you to all our audience, to all the questions and comments you raised. We will definitely come back to them. We will discuss these questions in other events. After the summer break, we have a couple of events coming up, so please look out for them. The only one I wanted to mention now is on the 21st of September, we have the final conference of the Progress Project, and you will all be invited to attend this one very soon. And that leaves me just with thanking you all again for participating in this event, wishing you a good afternoon, and hopefully see you next time at the next event. Goodbye, everyone.
It was a pleasure. Thanks a lot.
Thank you, Johannes.
Bye.